Don't make that face. Don't make that face.
When's the last time getting people?
He just, 6, I think it went off early today. I don't know why.
So it won't hurt him either way, but I always tell parents to go ahead and try to wait until it's time for feeding to do this, because if you don't, if you do it right after feeding, the feeding all comes out.
Oh, okay. Okay.
When you pull that out.
Nope, we don't need to do that with our time. No, we don't. Okay, well that's good. He hasn't eaten in a while.
Okay. Yeah.
I just didn't want to feed him on the way here because I didn't know. I thought I'd just wait until we got home. Okay, go sit down, all right?
Okay, so when you open your box, I'll have this in there.
Mom, that's all.
This does not have to be sterile because the inside of the stomach is sterile. The food and water, yeah. So it doesn't have to be a sterile process, but you can wash it.
Thank you. Thank you, AJ. Sit down.
Okay, so this is the button. This is what's in your brother's belly. This is what it looks like. So you've only seen this part, and this underneath is what's in.
Okay.
So before you put the new one in, you always have to check. There's a balloon there, and you have to check and make sure that the balloon is okay, functioning well.
Before you put it in.
Yeah.
Okay.
Because they have had problems in the past with non-functioning. So they do leave you with these syringe in here. I usually do it. You can use the same syringe for both, but if you have extra syringes, and I'll give you this one, it's actually easier to have two. And I'll show you why here. We do 5 cc's is what we recommend. Sometimes if you're having difficulty with the buttons, you call in, we can tell you to add or subtract some water. But generally it's always 5 cc's.
Okay.
This is the quart for the water. So you check and see, it's just like a balloon. If there was a problem, it either wouldn't inflate or you would see water shoot out.
Okay. And 5 cc's isn't too big for him?
No.
Okay.
5 cc's for everyone. Okay, and then here I'm going to let you see how it feels to go ahead and hold on, I'm going to come over to you. Alright. So go ahead and feel what that's like.
Put it in?
Yep. You might want to hold it because sometimes it'll just pop right off for you. There you go. And you don't have to put the whole 5 cc's in to check it.
And then it just comes right back out.
Yes. So that'll be important to know for when you're putting it in. So then I would go ahead and just dip it into the petroleum jelly, or not the petroleum, the lubricant.
Yep.
So I would just, we want this to be nice and slippery when we put it in. And then I just leave it with the syringe attached, waiting to get this one out, which I'm going to let you do.
Oh, yuck.
So you need both hands for it.
Here, hold this. Hold it on now.
So yes, exactly. You'll secure it with your non-dominant hand and pull the water out with this hand. Now there might not be 5 cc's in here because it's been a while and water will evaporate, especially inside a body, especially if you had a fever. But what I do is I pull back as far as I can. That's it. Secure it there and push it in. There you go. Just push. That's it. And it'll want to come out on its own, but keep pulling back. Use force to pull back. That's it. As you're securing it, you're doing a great job. Now, until you feel that it's hard, that you can't pull anymore. So then what I do is I take the syringe off, and then I always squirt it out. If you're near a sink or keep a cup, I get rid of the water, and then I just do it again to make sure there isn't anything left in there. Oh my. Now, have you had any problems with leaking? From the food or just the leaking from the granulation?
Leaking from the granulation.
Those two, okay, so that means that you're finished.
It won't, it leaks around here.
Okay, so he did have some, we didn't pull anywhere near 5 cc now, so that's probably fine. I think we had, what did we get, about 3 to 4 maybe. So what I do is I put you can find your own way. It doesn't hurt him to leave it out. You don't want to leave it out for an hour, but if it's out for a minute, it's not going to hurt him. But what I do just to make it quicker for him is I use my non-dominant hand, pull straight out, and then with this hand you have it ready and you push straight down in. When you pull straight out, you move it to the side. Sometimes there's a little bit of resistance when you pull straight out. It's okay. It's not going to hurt him. You just pull. As long as you make sure the balloon is empty, you're fine, which we did. And then you push straight in. When you pull straight up, then you just go ahead and get rid of that, because then you're going to need this hand too. Then you secure this, and you push the water in. You can't go in the wrong spot, because they sewed the belly up to the wall of the stomach, so you can't put it in the wrong place. Basically, you cannot miss it. It's just nerve-wracking to do. So, go ahead with the left hand.
Sherry, make sure you get this without your finger on the leg. I want your dad to see.
Okay, so go ahead and pull it with the left hand. That's it. You're doing a great job. Great job. Just straight up. And especially the first time, they may cry a little bit. So he's okay. It just feels weird. Very good. Like putting an earring in. Actually, his skin looks pretty good. Now straight down in. Good. Now secure it with this hand. Press down on the button a little bit so you know that it's down in. Go ahead and put the water in. You're doing great, Mom. Put all the water in. And like I said, right. See how it wants to come back out? So you have to keep the plunger down while you secure this and pull the syringe out. Perfect. You're done. You did a great job. Nerve-wracking, I know. Nurse mothers, it was, even as a nurse, it was hard the first time I did it, so I understand. But you did fantastic. And your skin actually looks so good. I've seen a lot more stimulation issues. You look fantastic.
Well,
we'll still do a little treatment.
First time we brought him in, they said that was really bad, so they cauterized it. But
Actually,
that's not bad.
No, not at all. We can cauterize this little spot over here, but besides that, it looks very, very good. Huh. You did great. You didn't cry. You didn't move. You didn't do anything. You were perfect. A perfect patient. We tell patients after a big weight loss or weight gain, you should come in to be remeasured. If you notice a lot of leaking around the site with every feeding, you might want to come and get remeasured too, because as they get bigger, they'll need this. If you notice this dimpling in, or you can't twist it easily, that usually means they need a bigger size.
Okay.
And you'll just come in. That would be a nurse visit. You don't have to see the doctor for that. When you call to schedule, that's just a nurse visit, and that's easy Monday through Friday.
So what's
So what we do is we take this out, and we have a little measuring device we put in. It's smaller than this. It doesn't hurt at all. And this size here will go up. So he's 14 French 1.0 right now. And sometimes that is a lot. And sometimes after they're a toddler and they lose that big belly, sometimes then they'll go down a size again.
So what is considered a big weight gain?
Anything over 5 pounds for someone his age. So anything over 5 pounds. This is very good. Like I said, you can tell this will dimple into the skin. You'll have a lot of leaking, and you won't be able to turn it.
Okay, we haven't had that.
Yes. All right, buddy, you keep your hands off of this because this will hurt you a little bit. I don't want to burn you. You're doing a great job, little guy.
So, there was a spot on his clothes, I think yesterday or something, of milk. Did I not attach it right, or? No,
sometimes too if they cough, especially, sometimes that pressure and the abdominal pressure will force some milk to come out.
Okay.
If you see a lot of leaking, that he's saturating the clothes, he's not getting his feeding, that's what we'll worry about. Okay. Also, since he had a little bit less of the fluid in there too.
That could have been it?
Yes.
Okay.
That could have been it also.
That's good. All right.
What else was I going to say? There was something else. This burns a little bit, so this cream here will help it from burning so much. But you are like the perfect little guy. You are not complaining. No, don't touch that, honey. It'll hurt. It'll burn your skin. What else was I going to say? So if there isn't a weight gain or a weight loss, so you don't have any problems, we say come back once a year for remeasuring, just to check.
Well, how long? Everybody keeps asking me this, and I know you can't give me an answer, but
how long will he have?
Yeah, how long? What am I supposed to tell people? How? Well, will his feeding get better? Will it get worse?
Well, hopefully it will get better. If it doesn't, then you'll be referred to BCGI.
Yeah, I see Dr. Goyle, and then we have an OT that had just got their hours increased.
Exactly. And they'll continue to work on that to get his appetite better and try to get him to eat. And if it does happen that he, eats well and gains weight on his own, they would leave the button in for usually
6 months?
Yeah, 3 to 6 months.
Okay, that's what I heard.
Yes. And make sure that he's still gaining weight on their own, especially, they don't like to take buttons out during cold and flu season. Because kids can get real sick sometimes in cold and flu season. They just take their button out and they're not eating. They have to with that.
Yeah.
Depending on that, it's a hard question to answer.